Hi everyone, numbers seem pretty stable now, so we'll get going. I just want to say welcome everyone, and welcome to the fourth webinar in this series, hosted by Kidney Research UK and the UK Renal Data Network, and in partnership with the UK Kidney Association. And today's webinar is about the British Heart Foundation Data Science Centre and the Kidney Catalyst. Next slide, please, May. So I'm Miranda, and I'm the patient co-chair of the UK Renal Data Research Network, and I've been responsible for putting this webinar series together. And the next slide, thanks. So just a bit of housekeeping. If you've been before, you'll be familiar with this. The webinar is being recorded, and it'll be on the Kidney Research UK YouTube channel in a few days' time. If you could keep your microphones muted throughout, that would really help, but you can have your camera on or off if you wish, but bear in mind it is being recorded, so you might be seen. We're doing questions today through the Q&A function that's at the top of your screen. If you're using a smaller device, you might have to click more to find the Q&A. If you don't have the Q&A at all, it might be because you've got an older version of Teams, and you can use the chat to put your question in and we'll transfer it across. But we're not really monitoring the chat except for sort of technical issues. And if you'd like to use the live subtitles, then select more language and speech and show live captions. So that's the housekeeping. So the next slide is the aims of the webinar. So just, I do this every webinar just to tell you why we're doing it. It's to introduce patients and the public to the kidney health data landscape. We want to help you understand how patient data is used in kidney research, and we want to learn more about patient perspectives of data research. And supporting data research is part of a wider commitment to innovative research, which results in benefits to patients. The next slide, thanks. So this is how it's been going. We've already had 3. If you've missed them or if you want to see them again, they're available on Kidney Research UK YouTube. Just find their channel and search for Patient Data Webinar and it should come up. And as I said, today we're doing the BHF Data Science Centre and the Kidney Catalyst. We've got one more planned, but we haven't sorted out a date. It's going to be a patient forum on kidney data research, more of a sort of discussion thing than a webinar really. But I haven't really formed a definite idea about what topics that is. So if you'd like to let me know what you'd like to discuss, anything that's come up in the webinar, anything we haven't discussed, then please do get in touch and let us know. And the next slide is just an outline of the evening. We've got an introduction to the BHF Data Science Centre and the Kidney Catalyst from Samira Bell, who's the Associate Director of the Kidney Catalyst, and Ross, who's a Research Project Manager there. We've got Mike Molete talking about patient involvement in the Data Science Centre, and I'm going to talk a bit later about patient involvement in the Kidney Catalyst. And then we'll have some Q&A, depending how much time we've got, chaired by Beth Field, who's the new PPIE, or Public and Patient Involvement and Engagement Manager at the Data Science Centre. So that's what we're doing. And the first speaker is Samira, so we're just going to hand over to her, who's going to tell us about the work of the Data Science Centre and the Kidney Catalyst.
Thank you, Miranda. I'll just share my screen. Can everybody see that all right? Great. So I'm Samira Bell. I am a kidney doctor in Dundee and a researcher at the University of Dundee. I'm also a co-chair of the Renal Health Data Network, and I'm Associate Director at the BHF Data Science Centre. So I'll go through the next 10 minutes to give you a bit of understanding about what it is and what the new Kidney Data Science Catalyst involves. So the BHF Data Science Centre was launched in 2020, and it's a partnership with Health Data Research UK and the British Heart Foundation. So the British Heart Foundation funded the setup of this BHF Data Science Centre up until 2025, and we currently have a renewal bid in process to get another 5 years of funding to keep it continuing. So the aims of the BHF Data Science Centre are really to enable data-led research to improve heart and circulatory health. And it really aimed for the UK to be a centre of expertise for cardiovascular data science, create strong partnerships to improve health data infrastructure and reduce barriers to access these data, but most importantly, we wanted to make sure that the patients and the public were involved throughout all of the work to ensure that we build trust and the work meets people's needs. So there's 6 areas of work within the BHF Data Science Centre, and these are listed on the left. On the right, you can see that there are various different catalysts, and these catalysts have been set up with funding by charities. So there's diabetes and stroke, but the Kidney Data Science Catalyst was made possible by funding by Kidney Research UK. But I'll talk a bit about that later on, about what the Kidney Data Catalyst is doing and what the plans are. The Data Science Centre has leadership across the UK from a number of different institutions and a number of different specialties and expertise, and being able to draw on all this expertise is really valuable, and it allows us to really be able to push the work that we're doing in kidney disease and hopefully improve the care of kidney patients. So one of the areas of work is a whole population work, and so that the BHF Data Science Centre holds data for the whole UK population, which is an amazing feat and very powerful. So these are accessed through secure, trusted, what's called trusted research environments, so secure spaces where the linked data for all these routinely collected data sets like GP, hospital records, medications, vaccination are all linked together, and researchers can access these data to carry out research projects. It allows us to do research on a population of over 67 million, so you can imagine how impactful it is, the research that can be generated from this resource. This consortium, which does the work of the what's called CVD COVID UK using these data, spans a number of different institutions across the UK, a number of different data sets, multiple analysts, multiple projects, and has led to a lot of impactful work. And it's also supported the work of PhD and master students. And I think Isaac was on the call that I saw, who's a master student that is supported by HDR UK. So in terms of carrying out the research, the BHF Data Science Centre provides a whole service where you can go to them with a protocol or proposal. They can advise you on it, and they can look at what the data is available and what meets the needs. They can all then help you with the data creation, the data analysis, and then lead to the research output. So it can offer the whole service all the way through, but also researchers who want to do some of the data analysis can do that too. So really, it's taking advantage of routine clinical data that spans the whole lifespan. So from registration with your GP to events that occur during your lifetime, complications, follow-up, death. And this is massively impactful and powerful. I am just going to hand over to Ross Forsyth, who's our project manager, and he's going to talk about the cohorts platform as part of the BHF Data Science Centre.
Thanks, Samira. Yeah, just to quickly pick up on one area of work within the centre in a bit more detail. The cohorts team generally works with cohort owners, so that's generally research teams from across the UK that work in a clinical cohort. So the slide that Samira presented previously that shows that kind of lifespan of people engaged with cohorts shows that we often have really rich data collected at the point of clinical care. So somebody will have an acute event, they'll be engaged with a research team, and we'll collect really rich data at that point. But without linking to NHS records, we don't really know what people's health was like in the run up to that event, and we also don't know what their health was like in the 5, 10, 15 years following that event. So the UK Click platform is a trusted research environment that's been established to support those cohorts to perform that linkage in a more efficient way than is done currently. Generally, at the moment, cohorts will store their data within a hospital or a university server, and they'll apply to NHS data custodians on a one-to-one basis. What we see in those instances is lots of NHS data flying around to different locations across the UK. which has kind of increased data risks. So what we're trying to do is to house cohort data in one environment, and allow linkage to take place in that one space, and for the governance arrangements for all of those cohorts to be organised in one space. And why is this important to the renal world? Well, because we're British Heart Foundation funded, generally it's cardiac related cohorts that we work with. But I think we quite quickly realised that there's a lot of demand for this out with that renal, the cardiac world. So we have been working with a few renal cohorts to onboard their data to our trusted research environment and support them to have their data linked to NHS data. So the CKD and INS cohorts are two early adopters of the TRE. They're being onboarded to the trusted research environment at the moment, and we're working with them to have their data linked. The real ethos of the platform is that once those researchers have explored their original kind of research outcomes, we want to make that data available to a wider research community. So on the slides before, you'll see that there's an opportunity for people to access that data if they go through the appropriate approvals process. And sorry, Samira, on the next slide, this is really just to show the ambitions for the platform over the next 5 years, should we get that funding extension from the BHF. So at the moment, we collect fairly flat files, so CSV files that are collected as part of the research. But what we want to explore is how we can make more use of images that are collected, smartphone and wearables data, genomic data, and really, again, to make that available to third-party researchers and to have that data linked. And we really think that if we can make these data available to people, it'll open up more opportunities to make new breakthroughs, identify new mechanisms to prevent and treat these clinical conditions. I think that's really it on the cohorts theme. I'll pass back to Samira to dive into the rest of the catalyst.
Okay, thanks, Ross. So the Kidney Catalyst was made possible by funding by the Kidney Research UK, and it started last June, so we're almost a year into it. And really what the aim was to accelerate research at the interface of kidney and cardiovascular disease. So cardiovascular disease is a very important condition that affects many kidney patients, but also kidney patients are more likely to develop cardiovascular disease, and cardiovascular disease can lead to kidney disease. So they're very closely interrelated. So the aim of our catalyst is really to bring a group of key stakeholders working in this area together, and use the expertise and the infrastructure as well as the data within the Data Science Centre to benefit kidney research and kidney patients. So as I said, we want to ensure that patient voice is represented throughout, and we were very lucky to have excellent PPIE with Beth as our PPIE manager. And one of the first things that we wanted to do was identify what the research priorities were for the community. So this is our team. So you've met Ross, Amy is our research project coordinator, and Beth, who's on the call, is our PPIE officer. So our prioritisation exercise was the first thing we did to identify what the priorities were in relation to cardiovascular and kidney disease. And we sent this question out to patients, to clinicians, to researchers, and obtained feedback from all these people on what the priorities were. We then used those data to aggregate to establish themes that came out from this, and we used those themes to bring a group of people, including patients, together to a workshop where we further refined the questions from what came out of the larger initial scoping exercise. What we've done since then is we've carried out a survey online to prioritise these questions, so that we have now come up with a list of the key questions in relation to cardiovascular and kidney disease that are important to patients and to clinicians, researchers, and then hopefully we can use this to guide future work. Another aspect of what we're doing is working with the renal community to develop a definition for chronic kidney disease. So when you use routinely collected data, there are many different ways to define chronic kidney disease, and it's very variable, and people do it in multiple different ways. And as you can imagine, this then impacts on the quality of the research that's available. So what we're doing is working with the BHF to develop a phenotype that's approved by the community. So what I mean by phenotype is a set of codes that will define chronic kidney disease in these patients. And then this will allow for researchers to use this tool when they do their own data research and enable comparison and high quality research in chronic kidney disease. We've also, thanks to Kidney Research UK, had funding for driver projects. So these are projects that will use the data on the BHF Data Science Centre, and we had a competitive process for this. There were 9 applications and 3 were funded. So as you can see, they're from all across the UK, so Leeds, Edinburgh, London School of Hygiene and Tropical Medicine, and these are all looking at different aspects of kidney disease and cardiovascular disease. At the moment, the permissions for the BHF Data Science Centre need to have a COVID angle. So that's why you'll see why COVID is included in all the projects, and that's due to the governance and permission around data access. So hopefully by using this real world data and being able to use this resource, we can do high quality, large scale research. It's quicker, cheaper and more efficient than a clinical trial. It means that it's representative. Clinical trials often have a specific type of patients, which are often men. Women are underrepresented, different demographics are underrepresented, but if you use real world data, you can have truly representative research. We're very lucky in the UK to have data that we can link to all these data sets, and the ability to do this. We're pretty unique in that respect, and we're fortunate that Kidney Research UK have provided the funding that we can work with the BHF to improve the life and care of, hopefully, of patients with kidney disease and cardiovascular disease. Thank you very much. If you have any questions or anything, please feel free to get in touch. Thank you.
Thank you so much, Samira and Ross, for such a comprehensive talk about all the work that's going on, and it's really amazing to see how much has been achieved in this first year. So now we're going to hear from Mike Molete and about his experiences of being a public contributor to the Data Science Centre. So thank you, Mike.
Yeah, thank you very much. So starting with what attracted me to health and care PPI, it started with me being a carer for my father. Then I became a person affected by multiple morbidities. Back in the days when it was more about healthcare professionals deciding what's best for the patient and less about what matters to people affected. So the second reason was about health inequalities. There is something about existing disparities and barriers which make Black and other minorities, including other marginalized groups, to become disproportionately affected, therefore experiencing poorer access and poor referral pathway. As a result, by the time they come into contact with healthcare services, they are really ill and have severe complications. I'm a living witness to that as a carer with my own conditions. Privately, as a former healthcare worker, I carry the disappointment and the shame that for many years, I blindly worked and helped deliver healthcare services without thinking about what would I like the situation to be if I was a patient and a carer. I was too complacent with one system that fitted all, so long as it was within the set guidelines. Since then, I became a patient and a carer, and I felt I wanted to champion patient voice and make life better for carers. I am one of those people that openly advocates that carers' needs be considered at the same level of importance as the needs of the patient. Currently, I'm in PPI not just because I wanted to be part of the collaboration to make services and interventions get better based on people's experience of care, but also I feel privileged to be part of shaping things with people rather than for people. This is so that we can make engagement more meaningful, so that we can share a common agenda and share a shared and enjoy a shared action plan. So why Health Data Research Center? My experiences with cardiovascular disease, kidney conditions, and mental health silos, it has shown that many decisions and strategies about health and care rely on research and data collection from patients. I might add that, like everyone else, I have always been uncomfortable with our information being collected, being shared, and sometimes manipulated to inform decisions about our future without our consent or input. So upon seeing a PPI advertisement from Health Data Research, I felt a compelling need to join the platform. So the aim was to elevate the voice of patients and carers and also convey the complexities of living with multiple mobilities as a Black person. Although at the time I lacked knowledge and research data, my motivation was simply, that I was a carer, I was a patient, and someone who is seldom reached or someone often engaged with as a token or tick box. Since then, I've been inspired by the power and the benefits of data science to drive improvement, streamline services, bring inequalities to life, and contribute to a person-centered agenda. For most patients and families, research engagement is an essential missing link, as well as an appreciation that the use of data is progressing faster than some of us can comprehend. So that I have seen several benefits of patient and public involvement since I became involved. First, I experienced the honor of being sought after purely as part of a Black and other ethnic minority group to collaborate with BHF Data Science Center. I started being a member of the CVD COVID UK Approval and Oversight Advisory Board. Here we were considering the voices of patients and carers in research proposals. We were looking at their relevance, the importance, and therefore we were supporting funding decisions. It is weirdly elevating, knowing that you matter as a person, especially as a seldom reached group. I felt good that my experiences and voice are respected and valued. The way I see it, it's like participating in a platform that bridges the gap between different people so that no one is considered hard to reach. It makes you feel worthy being part of a process where people eagerly ask you to comment, to share your views, your experiences, and want to learn more about what matters to you. I am part of those people who supported Nothing About Me Without Me initiative, ensuring that whatever the design, it is acceptable to patients and carers, and it's considering what matters to those affected. I'm helping to remove the stigma and the barrier. People want to get involved, not just as subject, but as the reason behind it. I am today a proud witness to PPI that's continuous, that's focusing on maximizing patient perspective, reflecting on our diversity and celebrating inclusion. The best participation for me ensures a safe and meaningful engagement while recognizing that different people come with different skills and have different preferences. I cannot stress enough about how important it is to recognize and reward people for their time and effort they put into PPI. I have learned extensively, starting with appreciating the work researchers do behind the scene. I've witnessed the building blocks of project design. I have been part of co-creations, co-design, co-production of patient advisory groups, terms of reference, the topics, kidney prioritization workshop recently that's been mentioned, and even events like this. Importantly, I've learned to engage in constructive debates and present my views succinctly without fear of recrimination. I've enjoyed being part of successful networks and collaboration with diverse group of people. Finally, Although there is still a long way to go, I'm no longer perceived as a hard-to-reach person. I'm experiencing a collective transformation in my lifetime, and every available and willing patient and carer can do the same. Thank you.
Wow, thanks, Mike. It's kind of left me a bit speechless. It's just so wonderful to just hear your experiences as a patient and a carer, and what it means to you to do patient involvement work, and what it brings to the people that yourself and the people that you're working with. That was absolutely incredible. Thanks so much for joining us and telling us all about your experiences. It's been really lovely having you here. So I'm now going to, in fact, if you pop this slide onto the next one, May, that's just to indicate that I've now swapped hats, and I'm no longer just the patient co-chair of the data network, but I'm also now a public contributor to the Kidney Data Science Catalyst as part of the BHF Data Science Centre. So, and that's how I'm kind of going to give my talk. Next slide, please. So if you came to webinar 2, you'll have seen that I gave a little presentation about patient involvement in data research generally, and I talked about the things that are written here about what is patient involvement and why it's important, and particularly what makes kidney patients particularly valuable for contributing to data research. So if you want to go and see that, I don't want to overlap too much this talk, so if you want to go and see that, as I said, it's on YouTube, so you can go and watch that. Next slide, please. So my way into PPI is sort of very different to Mike's, and I think you'll find that whoever you ask, they've all had a different way into patient involvement. So I've been a kidney patient from the age of 18. I've got a scientific background and an interest in numbers. I've did genetics at university and trained as a chartered accountant. But actually, I started being a patient rep in the world of maternity. I've been trained as an NCT and National Childbirth Trust antenatal teacher. And that kind of really gave me an understanding of how individuals could make choices about their care and advocate for themselves. And I ended up setting up a website called Birth Choice UK, which was to help women understand the choices. And then that led me into being a sort of maternity services rep on a number of committees looking at improving maternity care and developing policy. And at the same time, I was being a kidney patient myself, and I came to see how I could use these skills that I had kind of learned and was teaching to new parents, that I could use them firstly for myself in a clinical situation. But gradually I realized that I could be a lay rep on NICE clinical guidelines. So I was on a guideline for chronic kidney disease and one for patient experience of NHS care, NHS services. And I could see that I could actually, begin to make a difference there. I got very involved in working with maternity data for many years. The Birth Choice UK website presented maternity statistics in a kind of accessible way to help women make choices about their care. And this was about 25 years ago when the internet was new. And I think perhaps we take it for granted a little bit that we can go onto a website and look up data, such as looking at the renal registry reports, and we can just find out what we want to know. But at that time, the maternity statistics were otherwise available only as paper booklets stored in a cupboard at the Department of Health. So having them on a website sort of felt like the dawning of a new era, really, which has just grown and grown. I've also worked on some academic data projects too. The City University one was an NIHR funded project looking at using about 7 million linked maternity records from 3 different data sets, looking at safety of birth. So in 2021, when I became the lead of the lay advisory group at Kidney Research UK, it perhaps was natural that I would then become involved in the Renal Data Research Network as a patient co-chair. And then from that has followed the work with the Kidney Catalyst. So next slide, please. Thanks. So I've just written here, why data? Well, this is really about how I feel about data. I mean, to me, data is the stories and journeys of patients. I mean, essentially, it's as Mike has said, it's our data. So it's our medical histories, it's our blood results, it's our surgeries, and it's all recorded. And I think that if all of those thousands of experiences can all come together and make a difference to our care in the future and the care of future kidney patients, then that's fantastic. So to me, data analysis it's about seeing the patterns, it's about finding the stories, it's about understanding the patient journeys, recognizing the human essence in those numbers and using it to make things better so that we are diagnosed faster, we have more effective, more equal treatments, or fewer ineffective and harmful treatments. So this data has so much potential, and with AI, it can spot patterns that we can't even see. And so I think it's quite a thrilling time to be involved with data research. Next slide, please. So as Samira's already said, the Kidney Data Science Catalyst has been made possible by an investment by Kidney Research UK. The initial work was done by the Renal Data Research Network. So together with the clinical co-chairs, Samira and our other co-chair, Nigel Brunskill, we looked at a number of potential data partners to accelerate data research. And in the end, we agreed to recommend the BHF Data Science Centre to Kidney Research as a partner. And I was then invited to be on the Catalyst Advisory Group and the PPIE group. And so I think that sort of having been involved in the creation of it, as a patient from the beginning, I kind of feel a responsibility to the Catalyst and also kind of pride in it as well. So beyond just being a contributor, I kind of sort of feel somehow sort of personally invested in it. Next slide. Thanks. So Samira's explained a little bit about the Delphi prioritization exercise and the workshop that went with it. And Mike and I were both at the workshop. And for me, it was really important that this questionnaire, the original questionnaire, didn't just go out to researchers and clinicians, and it went out to patients too. And the questions that Samira showed had been reviewed and shaped by public contributors to the Data Science Centre before being included in the questionnaire, which was very important. So the next slide. Thanks, May. So these are some of the results that came from the initial questionnaire to patients about what patients want from kidney data research. And I won't go through them all, but basically they wanted to have better detection and treatment of kidney disease, to look at the interaction between cardiovascular disease and kidney health, and looking at more personalised treatment approaches and AI, as well as reducing the health inequalities that Mike has talked about. Next slide, please. So Samira's also mentioned the driver projects for funding, and I just kind of wanted to give a little bit of my point of view. I was invited to be part of the assessment process, the assessment panel as a patient. And it was quite a daunting prospect reviewing all of these proposals. I am fairly used to reviewing grants. It's part of what I've done in my role at Kidney Research UK, is reviewing research grants. And as a patient, you are really coming at it at a very different angle to the researchers and the clinicians who are assessing them. We look very particularly at whether there will be any patient benefit that arrives from the research. Whether patients have been asked to help to shape the research question, and how patients will be involved in the ongoing research and with dissemination of it, and to make sure, as Mike mentioned, that our confidential data is going to be treated appropriately and sensitively and transparently. I have to say, some of the methodology of these data research projects is quite complex, and despite my love of numbers, I am no statistician, but the BHF Data Science Centre gave us a lot of support as patients, and really helped us to recognise the value of our contribution as public contributors. Next slide, please. Thanks. And so I think one of the other joys about being part of the Kidney Catalyst is I hadn't really realised when I agreed to be on the PPI group for it, that I would be part of something much bigger. I didn't really know an awful lot about the PPI of the Data Science Centre, and it's got a very strong PPIE strategy at the centre of it, such a big part of the Data Science Centre. And so I just wanted to mention that. And that strategy says, you know, it's important that health data research remains relevant to all patients in the public, that public contributors help to design surveys and communications to capture patient and public perspectives, just like it did for the Delphi study, and that building trust and transparency with patients and the public is another core part of the approach. So it's really good to have all of that right at the centre of what's happening, and that reaches into all of the work of the Data Science Centre, including all of the different catalysts that Samira mentioned. And the next slide. Thanks, May. So hopefully, if you've been coming to these webinars, you've got a flavour for how patients can be involved in data research in many different ways. And I say, if you're interested, you know, just do it. There are different ways that you can do it. You could join Kidney Voices for Research on Facebook. That's a group where you can see opportunities for all sorts of research, not just data research, but other kidney research. If you're particularly interested in data, you can join the UK Renal Data Network. That's the link to it, and you can contact us. There's no requirements to be a member. You can just put your name forward and we'll make sure you get all of the communications. You can come to the meetings. You can maybe even join one of our work streams. And there are opportunities in various data and patient organisations. So we've mentioned HDR UK, they've got a patient advisory group, BHF Data Science Centre itself, the Patient Engagement in Data Research Institute, PEDRI, Understanding Patient Data, Use My Data, all sorts of organisations. As I said, it can be daunting, but I've had 30 years really of trying to make sure that healthcare and healthcare research makes things better for patients, even in small ways. You never really know what a difference you're going to make, whether it's to an individual research project, or maybe just changing the way one clinician or one researcher thinks about the experience of the patient and feeds that into their work, or encouraging one patient to ask for what they need in a clinical setting. Or maybe it's contributing to national health policy and changing the way that health services are run. So my recommendation is just jump in, and if you need any help with that, you know, just contact us and we'll help you. Next slide, please. So this is my thank you to you for listening to my presentation, but also with my other hat on, I would like to say thank you to all of our speakers for joining us today and for all the work that they do for patients. And now I think we've got a few minutes for questions. I don't know if we've got any questions. Next slide as well, May, thanks.
So I'm not seeing any questions in the Q&A section, but I don't know if anyone feel free to use the chat box or the chat function, because we've got about 5 minutes to ask for any questions. I might be cheeky and ask a question whilst waiting if anyone wants to say one. But yeah, you kind of touched on it about the end. So just kind of you kind of touched on it there about your kind of initial maybe like reservations about PPIE, and this is also for Mike, but what is it about like doing PPIE engagement that makes you continue to do more projects with us and to host webinars like this?
Mike, do you want to answer that?
For me, it really is to finish what I started, because we're still a long way to go. So much as there's more awareness about the importance of engaging people of diverse people and diverse voices, there's still a lot to go. There's still a lot more people that don't know what we're doing. So I'm just adding up on what's happening.
Thank you.
Yes, and for me, I think it's become a bit of a habit. I think really, I'm not sure what else I'd do. I think, as Mike says, I mean, there's just always more to do. You know, and what we really want to do also is to encourage more people to come in to be involved. I mean, like I said, I've been in this for a long time, and I think that public and patient engagement has become a lot more formalized. You know, PPIE managers didn't exist, you know, a few years ago, and so I think that developing strategies and having this sort of more formalized way of doing things means that actually we can achieve a lot more than what used to be a pretty sort of grassroots endeavor, I think, for a lot of us. So that, you know, it's very exciting to see that it has become really much more mainstream, and that funders are requiring patients to be involved before that they'll give out money for different projects. So I think we're becoming more necessary as well to researchers and clinicians, and we want to make it easy for them to be able to access patients and access patient views.
I have to say, from a clinician point of view, having yourself and Mike involved in the Catalyst, the Renal Health Data Network, it's so valuable, and it really enhances our perspective, because we can't understand what it is to be on the other side. So I think what you and Mike do is amazing, and we're really, really grateful for all your time that you do, unpaid, in your own time, just out of the kindness of your heart.
I should say that the BHF Data Science Centre are very good actually at recognising our contribution and provide some financial recompense for our time, which without any question at all, it's always just offered, which is fantastic as well, because not all organisations either do that or can do that. So it is very much appreciated, I think, by those of us who do work for the Data Science Centre.
Amazing. Those are great answers. I don't know if anybody else has any questions, final thoughts before we close.
It looks like that's it. Thank you so much. Sorry, I didn't introduce you to do the questions, but we're really grateful for you for coming on, and also just sort of, you know, being here and showing that, you know, representing the PPIE function at the Data Science Centre as well. So thank you all very much. And so yes, so the next the next webinar is the date is to be decided. It was going to be in June. It might end up being July, but we'll certainly be in touch. If you've registered for this one, then you'll get information about the next one to follow. And if you do have ideas on what you'd like to discuss, then please do let me know. So thanks to everybody for coming, and everybody behind the scenes who's been supporting the webinars. That's been great. And look forward to seeing you next time. Thanks all.